Today I want to talk about something many people overlook. Your feet can show early warning signs of diabetes before you even realize your blood sugar is high. These signs are not random. They are your body trying to tell you something important. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. Diabetes affects millions of people worldwide, and many do not even know they have it. High blood sugar levels can silently damage nerves and blood vessels throughout your body. Your feet are often the first place these changes become visible. Understanding these warning signs can help you seek medical attention early, which can prevent serious complications. I am going to explain 9 specific signs in your feet that could indicate diabetes. Pay close attention, because some of these signs are easy to miss. The first warning sign is persistent numbness or tingling in your feet. This condition is called peripheral neuropathy. When blood sugar remains high for extended periods, it damages the small nerves in your feet. You might feel a pins and needles sensation, or you might notice that your feet feel numb, especially at night. Some people describe it as wearing invisible socks. This happens because high glucose levels interfere with the nerve's ability to send signals properly. The numbness usually starts in the toes and gradually spreads upward. It can affect one foot or both feet. If you notice this sensation lasting for days or weeks, it is not something to ignore. The second sign is a burning sensation in your feet. This is also related to nerve damage from high blood sugar. Many people with diabetes report feeling like their feet are on fire, especially when they are resting or trying to sleep. The burning can be mild or intense. It might come and go, or it might be constant. This happens because damaged nerves send incorrect pain signals to your brain. Even though there is no actual burn or injury, your brain perceives heat and pain. This symptom can be extremely uncomfortable and can affect your sleep quality. If you experience unexplained burning in your feet that does not go away, it could be a sign that your blood sugar levels need to be checked. The third warning sign is extreme sensitivity to touch. This is another form of diabetic neuropathy. Your feet might become so sensitive that even the lightest touch, like bedsheets brushing against them, causes discomfort or pain. This condition is called allodynia. It occurs because damaged nerves overreact to normal stimuli. What should feel like a gentle touch feels painful instead. Some people cannot tolerate wearing socks or shoes because of this sensitivity. This is a clear indication that nerve damage is occurring. It is important to get your blood sugar tested if you notice this symptom. The fourth sign is slow healing wounds or sores on your feet. Diabetes affects your body's ability to heal itself. High blood sugar levels reduce blood flow to your extremities and weaken your immune system. If you notice that small cuts, blisters, or scrapes on your feet take much longer to heal than they used to, this is a significant warning sign. Normal wounds should start healing within a few days. But in people with diabetes, even minor injuries can remain open for weeks. These wounds can also become infected easily because high blood sugar creates an environment where bacteria thrive. Infected wounds can lead to serious complications, including ulcers. Never ignore a wound on your foot that does not seem to be healing properly. The fifth warning sign is changes in skin color on your feet. Diabetes can cause poor circulation, which affects how your skin looks. You might notice that your feet appear unusually pale, or they might have a bluish or reddish tint. Some areas of your feet might look shiny or feel tight. This happens because blood is not flowing properly to the skin. Reduced blood flow means less oxygen reaches the tissues. Your skin might also become thin and fragile. In some cases, you might see dark patches or discoloration around your ankles or on the tops of your feet. These color changes are not just cosmetic. They indicate that your blood vessels are being damaged by high glucose levels. The sixth sign is dry and cracked skin on your feet. Diabetes affects your body's ability to retain moisture. High blood sugar can damage the nerves that control oil and moisture production in your skin. As a result, your feet might become extremely dry. The skin can crack, especially around the heels. These cracks can be deep and painful. They also create openings where bacteria can enter, leading to infections. If you notice that no matter how much lotion you apply, your feet remain dry and cracked, it could be related to blood sugar problems. This is especially concerning if you have never had this issue before. The seventh warning sign is frequent fungal infections on your feet. People with diabetes are more prone to fungal infections like athlete's foot. High blood sugar weakens your immune system, making it harder for your body to fight off infections. Fungus thrives in warm, moist environments, and your feet provide the perfect conditions. You might notice itching, redness, peeling skin, or a foul odor. The infection might appear between your toes or on the soles of your feet. If you keep getting fungal infections despite treatment, or if they keep coming back, it is worth getting your blood sugar checked. Recurring infections are often a sign that something deeper is going on in your body. The eighth sign is swelling in your feet and ankles. This is called edema. Diabetes can damage your kidneys, which affects how your body regulates fluids. When your kidneys are not working properly, fluid builds up in your lower extremities. You might notice that your feet and ankles look puffy, especially at the end of the day. Your shoes might feel tighter than usual. If you press on the swollen area, it might leave an indentation that takes time to disappear. Swelling can also occur due to poor circulation caused by diabetes. If you notice persistent swelling in your feet without an obvious cause like standing all day, it is important to see a doctor. The ninth warning sign is changes in foot shape or structure. Over time, diabetes can cause deformities in your feet. High blood sugar damages the nerves that control the muscles in your feet. When these muscles weaken, the bones can shift out of their normal position. You might notice that your toes start to curl or bend in unusual ways. This is called hammer toe or claw toe. Your arches might flatten, or you might develop bunions. Some people develop a condition called Charcot foot, where the bones in the foot weaken and fracture easily. These structural changes can make walking difficult and painful. They also increase your risk of developing sores and ulcers because your weight is not distributed evenly across your foot. Now let me explain why these signs appear in your feet specifically. Your feet are far from your heart, which means they are at the end of your circulatory system. When blood sugar is high, it damages both nerves and blood vessels. This damage becomes most noticeable in areas where blood flow is already weaker, like your feet. Additionally, your feet contain thousands of nerve endings. When diabetes damages these nerves, you experience all those symptoms I described, from numbness to pain. The combination of nerve damage and poor circulation makes your feet extremely vulnerable to complications. It is important to understand that these warning signs do not appear overnight. They develop gradually as blood sugar remains elevated over time. Many people ignore these signs because they seem minor at first. A little numbness here, some dry skin there. But these small changes are your body's early warning system. Catching diabetes early can prevent serious complications. Uncontrolled diabetes can lead to severe foot problems, including infections that do not heal, gangrene, and in extreme cases, amputation. This is why paying attention to your feet is so important. If you notice one or more of these warning signs, what should you do? First, schedule an appointment with your doctor as soon as possible. Explain exactly what symptoms you are experiencing. Your doctor will likely order blood tests to check your glucose levels. The most common tests are fasting blood sugar, random blood sugar, and hemoglobin A1C. These tests will show whether your blood sugar is in the normal range, pre-diabetic range, or diabetic range. Early detection is crucial. If you are diagnosed with pre-diabetes, you still have time to make lifestyle changes that can prevent or delay the onset of full diabetes. Even if you do not have diabetes, these foot symptoms should not be ignored. They could indicate other health conditions that need attention. Peripheral neuropathy can be caused by vitamin deficiencies, thyroid problems, or other metabolic disorders. Poor circulation can be a sign of cardiovascular disease. Skin changes can indicate various medical conditions. The point is, your feet are giving you important information about your overall health. Listen to them. Let me also talk about prevention. If you already have diabetes or pre-diabetes, taking care of your feet is essential. Check your feet daily for any cuts, blisters, redness, or swelling. Use a mirror if you cannot see the bottoms of your feet easily. Keep your feet clean and dry. Moisturize daily, but avoid putting lotion between your toes because excess moisture there can lead to fungal infections. Trim your toenails carefully, cutting straight across to prevent ingrown nails. Wear comfortable shoes that fit well and do not rub or pinch. Never walk barefoot, even at home, because you might step on something and not feel it due to numbness. Blood sugar control is the foundation of preventing diabetic foot problems. Keep your glucose levels within the target range your doctor recommends. This usually means eating a balanced diet low in refined sugars and carbohydrates, exercising regularly, taking medications as prescribed, and monitoring your blood sugar levels. When your blood sugar is well controlled, the risk of nerve damage and circulation problems decreases significantly. It is not just about your feet. Good blood sugar control protects your eyes, kidneys, heart, and every other organ in your body. Regular medical checkups are also important. If you have diabetes, you should have your feet examined by a healthcare professional at least once a year. They will check for sensation, pulses, and any structural problems. If you have any of the warning signs I mentioned, you might need more frequent checkups. Your doctor might refer you to a podiatrist, a specialist who focuses on foot health. A podiatrist can provide specialized care and help prevent serious complications. I also want to address a common misconception. Some people think that foot problems only happen to people who have had diabetes for many years. This is not true. Nerve and blood vessel damage can begin even in the pre-diabetic stage. That is why recognizing these warning signs early is so important. Your feet are giving you clues about what is happening inside your body. Do not wait until the problem becomes severe. Another important point is that diabetes is not just about genetics. While family history plays a role, lifestyle factors are major contributors. Being overweight, eating a diet high in processed foods and sugar, living a sedentary lifestyle, and chronic stress all increase your risk. The good news is that many of these factors are within your control. Making healthier choices can reduce your risk of developing diabetes or help you manage it better if you already have it. Understanding these 9 warning signs empowers you to take action. Knowledge is the first step toward prevention and early treatment. Your feet are not just for walking, they are indicators of your metabolic health. Numbness, tingling, burning sensations, slow healing wounds, skin color changes, dryness and cracking, frequent infections, swelling, and structural changes are all red flags. Each one deserves your attention. I cannot stress enough how important it is to not dismiss these symptoms. Many people live with foot discomfort for months or even years before seeking help. They assume it is just aging, poor shoes, or standing too much. While those factors can contribute to foot problems, they do not cause the specific pattern of symptoms associated with diabetes. If you have multiple signs from the list I described, especially if you have other risk factors like being overweight or having a family history of diabetes, please get checked. Remember that diabetes is a manageable condition. With proper treatment and lifestyle changes, people with diabetes can lead full, healthy lives. But management starts with awareness. It starts with recognizing that something is not right and taking action. Your feet are talking to you. Are you listening? The connection between your feet and your overall health is stronger than most people realize. Traditional medicine has long recognized that different parts of the body reflect the health of internal systems. Modern science confirms this through our understanding of the nervous and circulatory systems. When these systems are compromised by high blood sugar, your feet show the evidence first. This is why a comprehensive approach to health is so important. You cannot separate foot health from metabolic health. They are interconnected. If you are watching this video and recognizing some of these signs in yourself, do not panic. Panic does not help. What helps is calm, decisive action. Write down your symptoms. Note when they started and how they have changed over time. Make an appointment with your doctor and bring this information with you. Be honest about your lifestyle, diet, and any other symptoms you might be experiencing. Your doctor needs complete information to make an accurate diagnosis and create an effective treatment plan. For those who have already been diagnosed with diabetes, use this information as a reminder to stay vigilant. Managing diabetes is an ongoing process. It requires consistent effort and attention. Your feet need daily care. Your blood sugar needs regular monitoring. Your diet and exercise habits need to support your health goals. It can feel overwhelming at times, but remember why you are doing it. You are protecting your body from serious complications. You are preserving your quality of life. I also want to encourage family members and loved ones of people with diabetes to pay attention to these signs. Sometimes the person experiencing the symptoms might not recognize them or might downplay their significance. If you notice that someone you care about is complaining about foot pain, numbness, or any of the other signs I mentioned, encourage them to see a doctor. Your support can make a real difference in their willingness to seek help. Education is a powerful tool in the fight against diabetes and its complications. The more you know about how diabetes affects your body, the better equipped you are to protect yourself. Share this information with others. Talk about it with friends and family. Diabetes is extremely common, and many people are walking around with undiagnosed diabetes or pre-diabetes. By spreading awareness, you might help someone recognize their own warning signs and seek treatment before serious damage occurs. In conclusion, your feet are remarkable structures that do far more than carry you from place to place. They are early warning systems for metabolic problems like diabetes. The 9 signs I discussed today, numbness and tingling, burning sensations, extreme sensitivity to touch, slow healing wounds, skin color changes, dry and cracked skin, frequent fungal infections, swelling, and structural changes, are all important indicators that should never be ignored. If you experience any of these symptoms, especially multiple symptoms together, make an appointment with your doctor for blood sugar testing. Early detection saves lives and prevents devastating complications. Take care of your feet, monitor your health, and do not ignore what your body is trying to tell you. So if you like this video, please like and subscribe for more videos like this.